What happens after you fall asleep? Let me show you for a tonsillectomy here. As we're going to sleep with propofol, I always use therapeutic suggestions so the patients wake up more comfortably. Mental health is super important. Anesthesia is no different. So then I had to tape the eyes shut to protect from corneal abrasions. I put the tape on my gloves first though to get some of that stickiness off because I don't want to lose eyelashes if I don't need to. That way it's more gentle on the eyelids and eyelashes when I pull them off. Now for the most critical part is where I need to bag mask the patient to breathe for them because they're not breathing anymore. After I confirm that I can breathe for them, then I give them the paralyzing medications. Showtime. After the paralyzing medications, I give one more breath and then we're going to intubate. You see the laryngoscope there and the endotracheal tube in my other hand. I don't have an assistant, so I'm doing this all on my own here, lifting up the epiglottis there, getting a view of the vocal cords. Now I'm going to place that endotracheal tube gently past the cords, not causing any dental damage, not causing any vocal cord avulsions. Got to be very, very gentle here. I take that dirty laryngoscope out now. I pull that metal stylet out. That's a flexible little metal there that helps the endotracheal tube go in the mouth. And now I'm going to raise the cuff, meaning I'm going to inject about 10 cc's of air in that syringe to seal off the trachea. Now we're going to connect to the ventilator and the patient's getting their first breath there through the ventilator. I'm using that weird technique there to not get goobers on that green bag. Now I have to turn the anesthesia on and tape that breathing tube so it doesn't get in the way of the surgeon doing the tonsillectomy. I use an over and under technique here with 2 different layers to make sure the endotracheal tube is going down towards the chin and not up towards the face. I next have to tune the ventilator, and now we're going to start surgery.